Welcome to Nurseslab. Welcome back, future nurses. If you're feeling nervous about the new NCLEX 2026 changes, especially prioritization and delegation, take a breath. You're not alone. These updates are a game changer, but today, you're going to crack the code. This video isn't just about passing the NCLEX. It's about mastering the advanced clinical judgment you'll need to protect your patients and step confidently into your nursing career. Let's dive into the future of NCLEX. The future of NCLEX. So what's actually changing in 2026? The NCLEX is shifting even deeper into real-world clinical judgment. That means fewer straightforward questions and more complex, layered scenarios that mirror what happens on an actual hospital floor. You'll see multi-step reasoning, prioritization with competing needs, delegation questions that test safety, scope, and leadership, and case studies that require you to think like an RN, not a student. This isn't about memorizing facts anymore. It's about thinking like a nurse, anticipating risk, recognizing instability, and making safe decisions under pressure. By the end of this video, you'll have a roadmap to navigate these new question types with confidence. Decoding next-gen prioritization. Let's start with prioritization, the backbone of safe nursing practice. 1. The stable versus unstable paradigm, reloaded. In 2026, the exam won't just ask who you see first, it will test whether you can identify subtle signs of instability. Think beyond the obvious. A patient with chest pain? Yes, urgent. But what about a post-op patient with a new restlessness and tachycardia? Or a COPD patient who suddenly becomes confused? Instability isn't always loud. Sometimes it whispers. 2. ABCDE and Maslow, but more complex. You'll still use airway, breathing, circulation, disability, exposure. But now, these frameworks appear inside multi-layered scenarios. You might have to prioritize a patient with a low O2 sat, another with active bleeding, another showing early signs of sepsis, and the exam wants to see if you can justify why you chose one over the other. 3. Common prioritization errors RNs face. Most candidates fail because they focus on the diagnosis instead of the symptoms. They miss early signs of deterioration, and they choose the nurse busy option instead of the nurse critical option. In 2026, the safest answer is the one that prevents the worst outcome. Mastering next-gen delegation. Delegation is where many students panic, but it doesn't have to be complicated. 1. The 5 Rights of Delegation, NGN edition. You'll apply right task, right circumstance, right person, right direction, right supervision. But now, the exam adds layers like staff competency, patient acuity, and legal accountability. 2. Scope of practice RN versus LPN versus UAP. Here's the quick breakdown. RNs assess, teach, evaluate, handle unstable patients, and manage IV pushes, except where restricted. LPNs reinforce teaching, perform stable assessments, administer most medications, and care for stable patients with predictable outcomes. UAPs, ADLs, vital signs on stable patients, transport, positioning, specimen collection. If it requires clinical judgment, it stays with the registered nurse. Delegation dilemmas. The exam will test situations like a UAP who is new, an LPN who is experienced but assigned multiple patients, a patient who is stable until they're not. Your job is to match the right task to the right person safely. Strategic scenario breakdowns. Let's walk through a sample prioritization scenario. Case study. You're the RN on a medical surgical unit. You have 4 patients. 1. A post-op day 1 patient reporting 8 out of 10 pain. 2. A COPD patient with new confusion. 3. A diabetic patient with a blood glucose level of 58 milligrams per deciliter. 4. A patient waiting for discharge instructions. Who do you see first? The correct answer, the COPD patient with new confusion. Why? Because confusion in COPD can signal CO2 retention, a life-threatening airway and breathing issue. Next, the hypoglycemic patient, because glucose of 58 can quickly deteriorate. Then, the post-op pain patient, important but not unstable. Last, the discharge patient, lowest acuity. This is how the NCLEX wants you to think: risk first, instability first, airway first. Your NCLEX 2026 action plan. So how do you prepare for these new question types? 1. Practice with purpose. Use question banks that mirror NGN-style reasoning. Focus on case studies, prioritization sets, delegation scenarios, and clinical judgment pathways. 2. Build your critical thinking muscle. Every day, challenge yourself. Who is most unstable? What can I delegate safely? What outcome am I trying to prevent? 3. Stay confident and composed. The NCLEX 2026 isn't designed to trick you. It's designed to see if you can think like a safe, competent nurse. And you can. If this breakdown helped you, hit like, subscribe, and share it with a classmate who needs a confidence boost. And if you want a full NGN practice set with rationales, drop a comment. I've got you. You're not just preparing for an exam, you're preparing for the responsibility of saving lives. You've got this. I'll see you in the next video.